Hello to all the readers of the Korean Journal of Radiology. Today, I'm excited to delve into the topic of conducting research studies using open source deep learning models. Increasingly, top scientific journals are requiring authors not just to submit their papers, but also to upload their computer codes and models. This might include detailed algorithms or even the specific weights used in their models. Why is this happening? The answer lies in three key benefits. First, making codes public enhances understanding. It allows peers to grasp the nuance of research in a way that just reading a paper might not provide. Second, it supports reproducibility. One of the cornerstones of scientific research is that others should be able to replicate your results. Access to the exact code used in a study is crucial for this. And third, it increases efficiency. When codes are shared, they can be reused and adapted, accelerating further research and discovery. Platforms like GitHub, Bitbucket, and SourceForge are at the forefront of this movement. They are not just code repositories. They are becoming integral parts of the scientific ecosystem, fostering a new era of transparency and collaboration in research. Therefore, reusing the developed model for the purpose of validation or clinical deployment is an efficient strategy. This approach saves significant time and resources. It builds on the reliability of previously validated models, enhancing the robustness of new studies. In an external validation study, you can assess the clinical utility of a prediction model. Alternatively, you can demonstrate that the model is ineffective in real-world clinical settings. For instance, in a study published in JAMA Internal Medicine, the authors demonstrated that a widely used sepsis prediction model exhibited poor discrimination and calibration performance at a national level. In addition, an external validation study may have the objective of extending use cases to target populations that are intentionally different from those in the original study. This can involve variations in race, ethnicity, age, or sex. Furthermore, aspects such as disease severity, the time window of the study, or the definition of outcomes may be modified. For example, our team conducted an external validation study on an open source AI model based on chest radiographs, designed for selecting candidates for lung cancer CT screening. We intentionally extended the application of the model to assess its added value compared to the updated USPSTF criteria. Originally, this model was developed as a potential replacement for those criteria. Then how one can find open source AI models? In research papers focusing on AI prediction models, authors often include details about the availability of the code. So look for sections titled Code Availability Statement or Data Sharing Statement for this information. In this example, the authors included a link to their GitHub repository in the paper. If you click on the provided link, it will direct you to a web page that displays an overview of the model along with an installation guide. Here's an additional example of code sharing. In the data sharing statement section of their paper, the authors included a link to their GitHub repository. They have uploaded their training codes and models to this GitHub. However, it's important to note that not all models are readily available for use. Commercial models, those under patent protection, or those with significant dependencies are not typically uploaded as open source models. Here's an example of a user-friendly open source deep learning model. Google Colab offers free GPU support for inference, although this is available for limited durations. In this open source model designed for chest radiograph-based prognostication, the authors have included comprehensive codes covering environment setup, data preparation, which encompasses pre-processing with sample images, and model inference. Even users with minimal coding skills can follow these codes to generate model outputs using their own chest radiographs. There are several important considerations to keep in mind for external validation studies. First, it's crucial to adhere to the image pre-processing steps used in the original model development study. For instance, in this particular study, the authors converted DICOM files to TIF format using DCMTK and subsequently to PNG format using ImageMagick. Secondly, it's important to check for any transformations of input variables. Dummy variables may be employed for categorical variables, and continuous variables might require normalization. Third, the model outputs might require a calibration procedure. This could involve using a logistic regression formula or perhaps just adding a constant. It's important to verify whether such a calculation is necessary for the model output. Lastly, it is recommended to use predefined cutoffs rather than creating new data-driven optimal cutoffs. Adhere to the cutoffs established in the original model development study. If you decide to use new cutoffs, additional validation for these cutoffs in a separate population will be necessary. This brings us to the final slide outlining the key steps in validating open source AI models. I hope this presentation has equipped you with the knowledge to conduct a successful and efficient model validation study by following these steps. Thank you for listening.